On this Thursday night, two neighboring provinces on very different paths. Ontario's plan to reopen gradually.
There are brighter days ahead.
As Manitoba locks down further.
We're in the darkest days.
Border battle, the calls to reopen the Canada-U.S. border. Breaking news, Israel and Hamas agree to a ceasefire after so many lives lost. Does it resolve anything on the ground?
We're fighting for our right to exist.
We have the story of one neighborhood where Palestinians face eviction so Jews can move in. What was once submerged reemerges. The lost village that reappeared after decades underwater.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin tonight with news from Manitoba, a province where events are making it painfully clear this pandemic is not over. Today, Manitoba set a record for daily new cases, 603 new infections. Hospitals there are under so much pressure, they are now sending patients to Ontario. 3 COVID patients have been flown to Thunder Bay, Ontario, an 8-hour drive from Winnipeg. And there could be more. Hospitals in northwestern Ontario are expected to take in as many as 20 seriously ill Manitobans. With the long weekend looming, provincial officials say they have no choice but to impose tougher restrictions to try to slow the spread. Effective 12:01 a.m. Saturday and until next Wednesday, outdoor gatherings with people outside your household are banned. Only one person per household can enter a business to buy essential items. And people are being told to stay home as much as possible.
I think we're in the darkest days of this time with this pandemic. Clearly, the case numbers are very, very high and unsustainably high. We need to suffer a little bit longer so we can turn this curve like we've done before.
Next door in Ontario, the situation is looking more positive. Infection rates there are dropping, vaccinations are rising, and Premier Doug Ford has unveiled a plan to gradually reopen. Eric Sorensen reports on what's in store for Ontarians in the days and weeks ahead.
It's beginning. Gradually, some normal activities will come to life in Ontario starting Saturday. Tennis, golf, and other outdoor recreation.
I think it's been a long time coming. I know it's risky, but I think it's time.
Still to come, though, 3 steps to reopen the economy more fully. The first step, outdoor dining, more retail business with limited capacity, some organized sports, campgrounds, and bigger gatherings, but not until June the 14th. A disappointment for those who wanted to see patios open sooner.
It's been challenging and frustrating, especially when we've done everything we possibly could to ensure that, our dining experience is as contactless as possible.
The reality is, COVID-19 remains a significant threat to us. This is being done slowly and with extreme caution. That is the only way it will work.
The outlook has changed where it matters most, in hospitals. In April, Ontario modeling suggested that cases in intensive care could spike above 1,500, potentially beyond the capacity of the healthcare system. Public health measures averted a crisis. Now, new modeling suggests that the ICU cases could drop below 500 by the middle of June.
The direction of the pandemic has turned, and if we're careful and cautious, we can maintain this momentum. And this momentum is what gets us to a good summer.
The provincial timetable in 21-day intervals will open up more of the economy as we get further into summer. And the hope is that vaccines will keep case numbers and hospitalizations from getting out of hand, even as we gather in bigger numbers.
And these vaccines are extremely effective at reducing transmission as well as preventing hospitalization. And these are things that will protect us against things like a fourth wave.
Reopening will depend on vaccination rates, and they are ahead of schedule. A cautious approach, but suggests this will not be a lost summer like 2020.
As long as it's done carefully, I'm for it.
And I think we're all eager to have this over, but I don't want to go back into a shutdown again.
It's not clear yet if Ontario will reopen schools for the last weeks of June. The Premier says scientific opinions are split on that, so stay tuned. Eric Sorensen, Global News, Toronto.
Vaccines are the ticket back to normal life, and Canada is nearing a milestone. 47.58% of eligible Canadians have received at least one dose of a COVID-19 vaccine now. That means we are on track to pass the U.S. Yesterday, 47.59% of the American population had received at least one dose. But on second doses, Canada lags far behind. Nearly 4% of Canadians have had 2 doses, compared to more than 37% of Americans. And it came as no surprise today that the restrictions on crossing the Canada-U.S. border were extended until June 21st. That border will reopen at some point, and as Jackson Proskow reports, pressure is mounting.
There we go.
As the U.S. throws open the doors.
This comeback is ahead of schedule.
And as Canadians eye a cautious summer return, there's still no plan to reopen the border, closed for more than a year.
If one person in Canada was fully vaccinated, that person should be able to cross the border.
New York Congressman Brian Higgins has had enough. He wants both countries to allow access for the fully vaccinated and believes Canada needs to ditch its strict quarantine requirements.
So all of those protocols that were put in place in the absence of vaccines, to me, are no longer relevant.
Neither the Trudeau government nor the Biden administration is ready for that. Canadian officials have said they want at least 75% of the population to receive 1 dose of vaccine before seriously relaxing domestic restrictions.
The whole issue of opening up the border with the United States, I think obviously it's a very live issue. From a technical public health perspective, we're certainly looking at the data.
Add to that pressure from premiers like Ontario's Doug Ford.
This is why I continue to call on the federal government to do more to secure our borders.
Who blames travelers for the arrival of more contagious virus variants. The border is now so politically sensitive that neither government is willing to set reopening targets or expectations.
We are certainly always assessing, as it relates to travel, borders, etc., what we need to do and keep in place in order to keep the American people safe.
All that uncertainty has led to calls for some kind of clarity now.
People need to at least have some sense as to what criteria are going to be used, even if they don't know the exact dates.
So that Canadians and Americans know what it will take to eventually get back together. With most cross-border trade still flowing freely, talk of reopening the border has become more of a public health calculation. And with virus-weary residents on both sides of the border, that makes it a much more sensitive subject. Donna?
Jackson Proskow in Washington, thanks. After some provinces across Canada stopped the use of the Oxford-AstraZeneca vaccine as a first dose because of safety and supply concerns, there are fears thousands of doses could expire and go to waste before they can be used. Michael Couteur looks at where all that vaccine may end up.
Insane. It is insanely frustrating.
Sherry Langer got her first dose of AstraZeneca on March 19th and is due for her second in 3 weeks. But with so many unknowns around that particular vaccine, the 69-year-old is still weighing her options.
It's not that I won't get AstraZeneca, it's that I will only get it if there is absolutely no option for me to get an mRNA.
A mRNA vaccine is her preference because the National Advisory Committee on Immunization said those are the preferred vaccine. Canada has a contract for 22 million doses of AstraZeneca, and some worry they could go to waste.
We are privileged when it comes to our position in the global perspective, and we shouldn't be wasting any doses. If we can't use the doses, we should send it to someone who can.
Last week, the former head of the vaccine rollout said there were up to 270,000 doses of AstraZeneca in Canada that could expire at the end of June. Thursday, in her first day in her new role, Brigadier General Krista Brody downplayed the amount.
At this point, we're tracking a very small number of doses that will expire at the end of May, and we're working actively with the provinces to ensure that they can be used in a jurisdiction that has the capacity to administer those before their expiry date.
It comes just a day after Newfoundland and Labrador said it has more than 1,400 doses of AstraZeneca they could be sending back to Ottawa. Meanwhile, doctors like Neely Kaplan-Murth are waiting to hear federal advice on vaccine mixing. The Ottawa doctor ran 2 Jabapalooza vaccine clinics recently, and she wants to hold another.
I need to know as a family doctor that I'm not going to let down all of those people who came to us for their first doses. They did the right thing by getting the first dose that was available to them.
The Deputy Chief Public Health Officer of Canada said NACI could be giving a recommendation on dose mixing by early June. Mike Couteur, Global News, Ottawa.
Canadian researchers are launching a clinical study that could provide more clarity for those who got Oxford-AstraZeneca as their first dose. The study will look at the safety and efficacy of mixing different types of vaccines. It will also examine the potential consequences of delaying a second dose by 4 months. Researchers want to recruit up to 1,300 adults in 6 provinces. The results are expected by July. Now that nearly half the Canadian population has had their first dose of a COVID vaccine, conversations are happening about what a return to work might look like. Officials at all levels of government have strongly encouraged Canadians to get the shot, but it is not the law. And as Anne Gaviola explains, for employers, that can make things complicated.
As companies across Canada plan for the new normal, many wonder what it means for their workplace. Can employers require you to get the jab?
It's not something an employer can do except in very extreme circumstances where it's just impossible to do the job safely unless you've been vaccinated. I'm thinking medical care, hospitals, elderly care.
While it's one thing for an employer to say employees should get vaccinated, it's quite another for it to hold up in court. The employer would have to prove that the job can't be done unvaccinated and that there's no way to accommodate. Even in healthcare, it's not cut and dried. New Brunswick Premier Blaine Higgs has tasked government lawyers with figuring out if vaccination could be a requirement for working in long-term care facilities. Unionized workplaces are a different story because the union can come to an agreement with the employer directly. It is a slippery slope, though. Labor and human rights laws protect a person's right to choose, whether it's for health reasons or philosophical ones. And employers aren't legally allowed to force workers to share medical information. They can encourage and support vaccination, like Ecom Timber Corporation offering $350 to vaccinated employees. Workers who can't get the jab for health reasons can get the bonus too.
We want this over with. We want to get back to normal as soon as possible, and this is the way to get there.
But in most cases, employers legally can't force or enforce a vaccination policy, and they have a duty to create a workplace that doesn't pit workers against each other on this polarizing issue.
I'd say that there is a potential for conflict in the workplace as it pertains to employees sort of taking the law into their own hands, if you will, about, if you have the vaccine or if you don't have the vaccine, and workplace harassment and bullying around that.
Anne Gaviola, Global News, Toronto.
A flashpoint for the violence in Israel.
You are stealing my house.
And if I don't steal it, someone else is going to steal it.
Coming up, the Palestinian family is facing eviction to make way for Jewish settlers. A ceasefire has been reached between Hamas in Gaza and the Israeli government. It was set to take effect at 7 p.m. Eastern, 2 a.m. local time, and it appears to be holding. Diplomatic efforts to broker this deal went on all day, and so did the violence. Up until a ceasefire deadline, Israel launched more waves of heavy airstrikes on Gaza. It says it targeted the homes of top Hamas commanders and their weapons storage units. Gaza also responded with more rocket attacks on Israel. After 11 days of airstrikes, the Gaza Health Ministry says at least 232 Palestinians, including 65 children, have been killed. Thousands have been displaced from their homes. Israel says 12 Israelis, including 2 children, have died. Israeli Prime Minister Benjamin Netanyahu met with his security cabinet today, and late tonight came word the operation in Gaza will end. The American president, Joe Biden, had put pressure on Israel and called Egypt's president, who has contacts with Hamas. Egypt says a security delegation will travel to Gaza and Israel to monitor and help stabilize this ceasefire. But this does not resolve any long-standing disputes. There is a cycle to this conflict that keeps repeating itself, and it all stems from a fight over land that Jews and Palestinians both believe belongs to them. That includes the Sheikh Jarrah neighborhood, less than a kilometer from the walls of Jerusalem's Old City. Israel occupies the territory, something most countries consider illegal, and now the Palestinian families who live there face imminent eviction in order to make room for Jewish settler families. Israel calls it a real estate dispute, but it is much deeper than that. Redmond Shannon has the story of one Palestinian family with strong ties to Canada.
Samira Dejani Bouderi and her husband Adel most likely have just 2 months left in the family house she grew up in.
I'm thinking a lot about that. Sometimes I talk to myself, Samira, stop thinking. Think about another things.
The Israeli courts, which will soon issue a final ruling, regard these cases in Sheikh Jarrah as private property disputes between Palestinians and Jewish settlers.
It's easy to yell at me, but I didn't do this.
Yeah, you are stealing my house.
And if I don't steal it, someone else is going to steal it.
No!
The Boudairis and other families who face eviction from the neighbourhood say it's the latest example of them being forced out and replaced with Jews. Back in the 1950s, when Samira's family arrived from Israeli West Jerusalem as refugees, her father named the new garden trees after his kids.
Unfortunately, my tree without leaves now and without green branches. But the roots are very deep.
So deep, these latest proposed evictions have led to protests, police scuffles, and fights with Israeli settlers already in the area. Eventually escalating into the deadly airstrikes and rocket attacks this month. When the State of Israel was founded, hundreds of thousands of Palestinians lost their homes and their land and became refugees. A few moved into Sheikh Jarrah, supported by Jordan and the UN. Then in 1967, Israel occupied East Jerusalem, including Sheikh Jarrah. Most countries still consider that illegal. Jews with historical links to the land could claim ownership. Palestinians have no equivalent legal right to reclaim homes and land they've lost.
This is one of the pictures that I love.
The Boudairis' daughter Rasha now lives in Canada and finds it hard to watch this play out from afar.
I'm so proud of what they're doing, speaking up, not giving up, never backing down, the sense of community and how the neighborhood residents just are coming together. It's not a tenants versus landlord case, rather we're fighting for our right to exist, to maintain living in Jerusalem.
A city where there's little room left on which to build, and if Palestinians leave, they can lose residency rights.
We are both in the 70s, and to begin a new life in this age, it's not possible.
But on August 1st, it's likely they will have little choice. Redmond Shannon, Global News.
Next, what emerged when the water receded? An Italian village is resurfacing for the first time in over 70 years. It was once home to hundreds of people before it flooded. As Mike Drolet reports, it's almost like a real-life Atlantis.
High up in northern Italy, tucked away in an Alpine postcard of a valley, sits the most curious of tourist attractions, a 14th century bell tower rising above the cobalt blue waters of Lake Regia. The tiny village of Couteur was put on the map 70 years ago when it disappeared. Against the wishes of the townspeople, Italian authorities flooded the town to make way for a hydroelectric plant. Couteur would become a curiosity for divers, despite the low visibility in its waters. And when some writers were looking for a locale for a horror TV show, Couteur fit the bill.
The lake has awakened once again. The curse destroys everything.
Curse, eh? Wonder what they'd say now that the village has awakened. A few months ago, the lake was drained for maintenance, leaving the town exposed for the first time since 1950. Yet because all the hotels are closed due to COVID, nobody outside the region seemed to notice, and only recently have visitors begun looking around. These steps probably were the entrance of a house or a farmhouse, says this tourist. Canada has its own Couteur. In Alberta, you can visit the resort town of Minnewanka Landing, but you need scuba gear. And 10 communities in Ontario were displaced when the St. Lawrence Seaway was flooded, leaving some towns abandoned and untouched.
It's very eerie. I mean, you walk through an abandoned ghost town here in Canada, and you get that eerie feeling as well. But when you're floating through it, it's a different feeling again. And you see things at a different level than you would than walking on a sidewalk or on a street.
Couteur, she says, is interesting, but given the opportunity to see the St. Lawrence towns uncovered, she'd pass. Better to keep their mysteries protected by the waters around them. Mike Drolet, Global News, Toronto.
And that is Global National for this Thursday. I'm Donna Friesen. Tonight's Your Canada is Lakeside Park in St. Catharines, Ontario. Thanks for watching. I'll see you Saturday for the new reality. Take care of yourselves. Bye-bye.